Hi Jo, can you tell me what you do at the LTA?
Hi Rachel, so I'm a consultant in sport and exercise medicine, and for the Lawn Tennis Association I am the team doctor for British tennis players.
Can you talk to me a little bit about what the expectation is around tennis and the governance at the international level?
Yeah, first and foremost we know that athletes want to compete on a clean and fair playing ground, and I think also the spectators want to know that as well, that it's not a fixed game already beforehand. The International Tennis Federation are doing a lot to promote clean sport, and as British tennis we need to support them and make sure we educate the players. That's through things like this, doing obviously online tools, but also face-to-face education and being available to chat to the players if they have any concerns about medication and supplementation.
And talking about medication, what would be the key points that players need to remember around that subject?
I mean, I'd want to hammer home that it's check, check, check. At the end of the day, medication is required at times throughout anyone's lifetime, let alone if you're an athlete. But some medications are not suitable because they are banned and they have a performance enhancing process. It's not to say they can't have it if it's desperately needed, and we'll go through that about TUEs in a second, but certainly from a medication point of view you need to check. They can check through an online tool called Global Dro, which is a great tool because you can put any medication in and it will come out with various brands and generic names as well. The downside of it is it's only registered countries that are on there that you can test those drugs, so if they're not on that then you have to obviously take extra care when purchasing drugs abroad, and certainly from a lot of sports they ask you not to do that. In our case with tennis it's pretty challenging because it's a world competition, so therefore the education and utilising that tool is really important. And if they can't get online and they obviously are still unsure, then they either have to wait to speak to someone or even talk to myself or yourself when they're next in the centre. Okay,
and if they have a medical condition that does require them to take something that possibly is prohibited, what do they need to do?
First and foremost, they need to come and book in and see their doctor. Now, if that's British tennis, they'd come and see me. And then I would go through the process of the therapeutic use exemption form, which basically means you have a good reason for a medical condition that requires you to be on this medication. The process I then need to go through is proving that there is no other medication available for them to take, which will involve things like getting documentation from their consultants under whatever specialists they are. And it's not necessarily one for life, you don't get a TUE for life, so it would be a renewing process as well. But if there is other medication available for them, then we would then look to use that instead. So it's not just a straightforward, they can take it. We have to go through a process, prove the means for it, and then put the application in. And that can take a bit of time, so preparation is key. If, God forbid, they're in an emergency situation and they're abroad and then operation and they're given a drug that is a banned substance, then we can do a retrospective emergency TUE, but in all cases it's much better to be prepared and not go into those situations.
Absolutely. And so moving on to testing, can you give the players an idea of some of the key points to remember around the testing process?
Yep, so a player can be tested at any point actually in the day, so they can be training, competition, or even at home. What will happen is they will get notified by a doping control officer that they are going to be tested, whether it's in the form of providing a urine sample or bloods. So what then will happen is they're taken into the office or a room that's been dedicated for the anti-doping process, and they'll be asked to select sealed bottles, or both for urine or blood, and they'll go through the process then of while being chaperoned, providing a urine sample up to 90 mils, and the bloods will be taken by a trained person if the bloods are required. Make sure that no name or identifiers are on there for you. It should be just a number, and that you can then keep a copy of that form for yourself as well.